So I'm wondering how we're going to know when everyone is back.
You're wondering how we'll know?
Mm-hmm.
See everybody.
If you look at the participant, at the participant screen, you can see who's got their video on at least and who's got the mic.
Right.
Yeah, so it looks like Judy doesn't have any mic or video on right now.
Right.
Nor does Jim, nor does Claire or Matt.
I think
Claire and Matt didn't anyway. Yeah.
They'll stay.
I'm here, but I prefer to stay off camera.
Got it, Clara.
Okay.
Hey, are you monitoring the raised hands? Are you able to see that?
I do see that, and that's why
Okay.
I will. I know we'll ask that you be up next. And
Oh,
then
well, that
Gary, and then it'll be.
I don't know how to use that function.
you have, yeah, go to participants,
Yeah.
and then you can see.
Oh, because we had that at the first meeting, but okay.
Right.
I will be good and raise my hand that way then. Thank you, Deb.
Oh, you're welcome. I just was wondering if somebody was monitoring them because otherwise I'd have to jump right in there.
No, So.
So just to clarify, the questions from the board at this time are in regard to the learning models and not general questions. Is that right?
That's my understanding.
Yes, we're trying to,
Yeah.
focus them in that particular section, and then we have operations coming up and some other pieces. So then at the end, of course,
Right.
anything is fair game.
Otherwise, it's like a bunch of second graders.
So are we safe to resume?
Yes.
Okay. Deb has had her hand up for a minute.
Oh, okay. And this question is for Steve. I listened carefully when you answered Chris's question, but in my mind, this is how I would understand it. So if the teacher is teaching fractions on day one, or fractions part one on day one, fractions part two on day two, fractions part three on day three, or whatever it is, the students that are in the virtual lesson that day, would they still be receiving the same type, like you said, the learning target?
Yes, that's correct, Deb.
Good.
That's the desire, I would think, to make sure our scope and sequence, meaning our order of what our students are learning and the focus of what they're learning, is going to be as seamless as possible. Because when we think of ourselves overall as a district, we want to remember that we will have some students who will be fully virtual. We would have some, by choice, we would have some students who would then be in the hybrid model. But if the future, which we don't know yet, right? But if the future brings to us a situation where all of us need to be virtual, we want to make sure that we can, again, ebb and flow within those two different scenarios by sequencing the instruction that way.
Thank you. Thank you. That's it.
Gary.
Yes, I just have a question of clarification, really. Steve, when you showed that model of the cohorts A and B, and say in A, right, there was like 8 students in class, and there was 2 off to the side virtually, and then there was the B students who were all virtual. Our friends in NINA have introduced this phrase, distant real-time learning, and I just want to confirm for everybody that that's not what this is. The cameras in the room aren't on, and the students that are virtual are, because that's two different distinct ways, right, to handle.
Yes, and that's
true virtual.
Yes, thank you, because that is an important point of clarification, that what you are referring to, Gary, would be live feed, like a live stream of instruction taking place in the classroom that students at home would be accessing. And, like any model of delivery, there's certainly advantages as well as challenges. And one of the challenges, especially being a very large district such as ourselves, and one of the lessons we certainly learned from last spring, is that if we look at trying to implement a model where all students of all grade levels are accessing instruction live through live stream at the same time, we are really making some assumptions, such as number one, all students at home are able to access the instruction through wireless connections from where they are, and that also we are able to support the wireless instruction on our end with all of our teachers being online at the same time. And so again, one of the key features of using that learning management system is the ability to have multiple opportunities of accessing. So if that's again, a taped mini lesson, a recorded mini lesson that students are accessing from home, but then the opportunities to follow up with their teacher with those questions, whether that's the Wednesday or through other means, that we are essentially spreading out the opportunities of how students are getting that information versus assuming everyone has to be online in order to do so.
Okay, yeah, that makes sense. I had two other really quick questions. On Wednesday, when the school goes into the deep clean, do teachers have the option of being in school at all that day in terms of maybe planning or things they wanted to do, or is that kind of everybody stay away, we're cleaning that day?
So Mark, do you want to comment on that? Mark Hansel is our Director of Facilities and Operations.
Sure, yes. I guess the more people in the building, Gary, the more challenging that becomes. And that's a lot of stuff we'll have to work through as we get those survey results back and start to realize who's all going to be there and how many spaces we're going to be utilizing each day. But I don't think that determination has been made yet on if we can keep staff in or out. Certainly adds to the challenge, though, if there's people inside the facility while we perform those tasks.
Yeah, and so that's probably similar to my last question. That's when the fully in-person group is in school. There was a mention of cleaning in the morning and cleaning at night. I was just curious when the morning cleaning was going to happen. I'm assuming it was somewhere into the day if cleaning at night had happened. The night before.
Mark's got it all worked out.
I guess I was just curious where the kids would go, if they were in school and it was being cleaned.
Mark, you're muted. There you go.
Yeah, Gary, we'll take care of all of that outside of school hours. So we'll clean at night and we will disinfect very early in the morning. So none of those activities will be occurring in the classroom while students are in the classroom.
Got it. All right. Great. Thank you.
To follow on these questions, Steve, just for clarification, the hybrid model, students they're not in the buildings on successive days. Is that correct?
That is correct, Kay. So they would only be in the building 2 of the 5 days that their cohort would be assigned to. Again, either on a Monday, Tuesday, or a Thursday, Friday. And the logic behind that is twofold. One, instructionally, to make sure we are having consecutive days versus like a Monday, Thursday, Tuesday, Friday, but then also for transportation.
I'm sorry, so the cohort will be there on consecutive days?
Will be on consecutive days, but only for 2 of the 5.
No, when we saw your screen, I understood something different from your model, the way it was. Okay, that is what I thought it would be consecutive, and so I just wanted to clarify. I had a couple of other questions, and I'm not sure if Judy, if you or Kurt would be addressing this, but on a couple of the slides, there's a notation about the conditions that would permit for in-person learning, or if conditions, I guess basically that was it. Now I know we aren't going to do a definitive at this point. We can go in person, or at this point we can't. But what guidelines would we use? And would this be considered right now, given where we are in the community? And I think Barry asked this question a little bit earlier, but I wanted to make sure I'm clear on it. If nothing changed, and it's August 12th, and things are as they are right now, would we be able to implement the fully in-person 4K, early childhood 4K, EC grade 4, and then the hybrid.
So there's a couple of layered questions. So I'm going to go back to, because I think there's different layers of these decisions. So through the years, we've tracked student attendance. So let's say we're talking about a particular school, and absenteeism and is specifically related to COVID-19. And so Kurt, maybe, so there's a school level decision, there might be a classroom level decision, and then there might be more of that district-wide decision. So maybe we could start at that school-based level and then expand up to the idea of the district-wide. So Kurt, can you talk a little bit about that?
Yeah, I think what the question I heard was, are we comfortable with the level that we're at now to provide a safe environment for the students K-4 to begin? Was that the original question?
That was part of it, yes.
Yeah, so I think the plan that's been presented, I think, is well thought through, that families who have special needs in their home setting or other variables that they're considering, there is still the virtual option, as I understand it, and they're hoping to have the in-person for that age group because of the social interaction and the growth that would happen. I think with the size of the classrooms, it also lends itself to a better environment where they're in almost what we would call a closed pod, that unit becomes a family in and of itself. And this gets to the question I think Judy was saying, is that if we had say a case of COVID in that classroom where that individual pod or grouping of students may have to be quarantined for a period of time, it wouldn't necessarily mean that the entire school would have to be closed. And I think that was the question that you were getting at, is how we do that currently with other communicable diseases, where we look at the number of cases, which classrooms they're in, who are the direct contacts of that case, and then make recommendations on quarantine based on that. So the way the model is set up, it would likely be that we would do a review of that particular classroom where a student or faculty member may have been ill, and then work out from there if the context would take the evidence that direction.
So in slide 16, there's an asterisk, and in red, only if the conditions of the pandemic permit in-person learning. And I'm trying to understand, would we consider that current conditions permissible for in-person learning?
So one thing that Kurt and I have talked about is this concept of widespread community spread. Am I getting that right, Kurt?
Yes.
Where there would be a third of the case or of the tests would be coming back positive. Am I calling that correctly?
I think what we're looking at is an escalation of cases in the community, where early on in our outbreak, you might recall, we had individuals that we had a known source that might have been travel history, or they themselves may have been in direct contact with a known case. Now we're in a situation where our community is experiencing, in addition to that, what's known as community spread, where we have people identifying that they really don't know where they contracted the illness. And that's indicative of community spread. I think what we're experiencing in Florida and Texas and California is what's been defined as widespread community spread, where you have hospitals that are at capacity. You have really a situation that the number of cases and the percent of positives that are coming back from testing, if testing is even available, to a point where it would make more sense, as many districts in those states are doing, is postponing or going to a virtual method. So that's that flexibility that we were talking about earlier, in the scenario base, that we would have a conversation. And I think Dr. Baseman described how we would engage a team of people, the school nurses, our office, certainly healthcare. We would look kind of at a community level. What are we seeing, and is it still a safe environment to have people come into the school setting?
So there's not a hard and fast data point, okay? It's really scenario based. I mean, the other piece that Kurt and I have talked about is, what if we get to a place where we just don't have the staff? We have staff who are ill, or they have ill members of their family that they have to take care of, or we don't have substitutes. I mean, it might be a staffing issue that results in going, so maybe it's a incorrect phrasing up there, but it's really more than just the conditions of the pandemic. It's our ability to staff and have a viable workforce to provide this.
And if we are asking families to make a commitment to a model, and that they would live by, and it would be a semester minimally. And I know it's hard to quantify, but for families, they just to make it so they can get a sense of what would this be considered okay to do it. I guess I am trying to quantify it a little bit, and it's a difficult question to do because we can't, and I know that we have to look at things through multiple, it has to be a broader look at that. I would go back to if with the key indicators, the trajectory and the burden, and then if your community is in that high transmission label, and yet we could still have some in-person schooling. So I'm just trying to make it, I guess I'm trying to quantify it a bit.
I think you raised some very good issues, and our own staff, we've talked about what would they do with their own family members and students returning. And I think what you're describing is families, just as school districts are planning, families are going to need to plan for that what if my student comes from a classroom and now they have to be quarantined for a couple of weeks. So there will be some planning that families will have to do, even in classroom setting, that might cause them to shift their plans a little bit during a time that they'd have to be quarantined. So I don't know if that was in the intent of your questioning, but certainly to maintain a safe environment for all students, there may be times when we would have to quarantine people from a school setting.
Okay, thank you. Leah.
So I hope this isn't too specific. This is for Steve, but since I had to do virtual learning with my kids in the spring, and I will have to again in the fall, I was wondering if you could talk just a little bit more about Canvas. It is a really wonderful learning management system, but you have to put things into it. So it's a bit like saying, I've been trained on how to use PowerPoint, but now I need to write 50 PowerPoint presentations. And I may know how to use PowerPoint, but I will never make PowerPoint presentations like Julie King. So when we get in, and I'm thinking particularly of elementary teachers who have to teach multiple subjects, how do we honor individual teachers' craft, but acknowledge we are under a time crunch? And are we pooling resources to make virtual learning less burdensome to staff and more engaging to students, and also more equitable across schools?
That's exactly the point our conversation landed on earlier this afternoon. So I thank you for bringing that up, Leah, because it is central to what we do, right? That we think about our overarching guiding principles. Is it safe? Is it accessible? Are we being flexible? And are we really focusing on that equitable access for all? And, that's certainly an area growing up with a mom who was an elementary teacher that my eyes were really opened when I became a secondary teacher teaching high school chemistry. I had a lot more students, but boy, she had a lot more subjects than I did. And every position has its own unique challenges. And so when we think of particularly with our elementary teachers and the conversations we've been having in our work group this afternoon specific to elementary, it's really thinking about, again, as an organization, whether you're large or you're small, how are you making sure that you're using your resources as efficiently and as effectively as possible? And so to specifically address your question, I think there's two parts in particular we need to be really mindful of. Yes, there's the technical component to using Canvas, which, yes, is important because, like you said, if you're going to make a PowerPoint, you need to understand the key features of the software. But just as, if not more importantly than that, is understanding how to be a virtual instructor. How do you engage students in a virtual setting compared to how you engage them when they're in person? And that's something, again, I apologize that the linked video from Kelsey Van Fossen wasn't able to show, but that is part of the overall flexible learning professional development through Canvas that we've been focusing on, is not just understanding how to use Canvas, but how do you reach out to students and engage them in their learning in a virtual setting. And along with that, when we think of our elementary teachers and the number of different content areas that they do cover with their students throughout the day and throughout the year, how are we using not only our professional learning communities, but also our, that Wednesday time potentially within that hybrid model to make sure that they are fully supported. And what I mean by that is that if we think of, for example, creating those supports that we can gradually release teacher into, because we do want to honor the autonomy and the true craft and art and science of teaching, that we establish ways for PLCs to work collaboratively on, let's say, here's our next week of instruction coming up for elementary, and how do we work among our different grade level teachers where we could have a certain group working on math and another group working on ELA, and really kind of that divide and conquer approach, because we will certainly develop better products when we take advantage of the wealth of resources we have from our teachers versus just a top-down approach of here's your blueprint course and here's everything you need, and just go for it and click the button, right? And that's not what we want for our teachers. That Canvas is the tool for implementing the instruction, but how are we as a district then wrapping around our teachers as much as we desire to wrap around our students to make sure that they are getting those different supports. And so that's why it's been so important in these conversations so far to make sure that we have AC&I and school climate and special ed and the specials along with EL, all the areas together, so that we can really approach this as a systems approach versus trying to look at each content on its own.
Do you feel there's going to be more resources? Because I fully appreciate that it was, it was an emergency that in the spring. I fully appreciate that, and you all did a wonderful job. But as a parent, I was left trying to find leveled reading for my child with a closed library, and there were resources out there, but then you had to navigate and go to all of these sites, and it was just that piece really felt lacking. And I think it would be reassuring to many people to know a little bit more. And so if this is not the right time for that, if that level of detail isn't there yet, I understand, but I think it would help people feel more reassured about this model.
Absolutely, because I also in another district experienced that as a parent as well of 4 school-age children. So I think a key piece that we also heard in our feedback during our distance learning days, but then also during the summer, is exactly what you're speaking to, Leah. Making sure we're also empowering our families and our parents regarding how to access both not only information, but also resources. And again, when we think of ourselves as an overall organization, when we had to respond very quickly last spring, we did have to make some very difficult decisions based on equity. That yes, we had iReady available for some students if they happened to be enrolled in a school that was currently piloting the resources, but not for many others. And so that put us in a position of really needing to restrict what access looked like so that we weren't perpetuating opportunity gaps among our students in the district. And so fortunately, by being able to move forward planning for these different models in the framework, we can really come through it with the mindset of how can we support our teachers to promote and implement these different resources through one single learning management system. So we don't have a tech services department that's scrambling to try to support, this, that, and the other, but we really do have a select menu of options that we know we can support, but then really kind of relaxing some of those restrictions that we had from last spring, because we just don't have the same level of guards or fences, so to speak, that we had when we had to react very quickly.
Thank you. That helps, Steve.
Sorry, Gary.
All right, I had a question, and we've been kind of dancing around this, and I think this might help us get a good grasp on a lot of people. In June, I remember various people in various levels of expertise talking about, your behaviors here in June are going to affect September, October, et cetera. And then the surge came, a few weeks after that, right? And so I'm wondering what scenario, we talked about situational based decisions, would have presented itself where we would have been sitting here saying 5 days a week, all in person. So correct me if I'm wrong, but I'm thinking it was probably that really low burden number would be one thing that's probably real important, right? Perhaps 2 weeks of no increase in positive cases. And then beyond that, we really don't have the absentee part to judge because we haven't had school yet. You know what I'm saying? But that's my question. If we could show people what success would have looked like or could look like, what situation would have had presented itself for us to be sitting here now saying, 5 days in person, everybody?
Kurt, do you want to take a stab at that one? I mean, I do think that 2 week marker of, that Gary mentioned in terms of cases and maybe being moderate, at least in some of those other categories on the chart.
Yeah, I think what we experienced last spring was a state decision. It was a state decision to cancel all schools. And so there wasn't a really local data that could enter into that decision. And I'm not questioning that decision. It was a novel virus, and we really didn't know how fast this was going to replicate throughout the country. We have seen an increase after Memorial Day where people are moving from outside of their household unit and meeting up with other people. And that's when the disease started to take off here locally. And that accelerated after July 4th. I think the optimism I have is that people now are seeing the results of that. We've had 2 incubation periods since July 4th, and we're seeing that acceleration. And I think there's a recognition that what we all do as individuals has an impact on the rates of transmission. So the use of masks, the social distancing, the frequent hand washing, these are messages that we've been communicating. But I think there's an increased awareness within the business community. You're seeing the mandatory masking that started out with some of the larger national chains are now coming to the local level, and people are embracing that. I think there's a higher expectation within the community of places they go that they want to feel safe. I have optimism that with increasing community policies that we're seeing across Northeast Wisconsin, that norming that we talked about earlier is going to make a difference. So just as rates go up, rates can come down by practicing those good preventive techniques. So yeah, I'm optimistic that rates could come down before school starts. And I think that's just something we're going to have to monitor. And I think the district's desire to have quarterly check-ins is also very sound. It gives us an opportunity with a certain date that parents will know there's a review point that decisions can be made and assessments can be made of where we are locally.
Right, and because the opportunity, is there, right? It's July 27th. I mean, the effects can be seen relatively quickly within 2 weeks, right? So August 12th is a day that we put in the timeline that's really important. And, some of the things we're doing now today will show very soon.
Yeah, the incubation period for COVID is 2 to 14 days. So if you really look at 2 cycles of that, that's where you would really begin to see a difference, I believe.
Okay.
And Barry.
Yeah, I have a few questions. Have you thought about the high schools and middle schools where you might have, even with the hybrid, somewhere between 600 and 800 kids in the halls between classes? And I know that would be a management issue. And how is choir and band and music going to be handled? I know there's a little higher risk with those activities for kids. If it's not virtual, virtual is kind of hard. And then a little bit on special education, staffing and so on. If the specialized folks that do, well, choir and band as well, if they need to be virtual for health reasons, how does that work? And the same with special ed, because in the elementary now, special ed students will be in-house through the full week, if I understand it right, which is probably a good thing. But, if you have a staff member who is assigned to that level that needs virtual, how does that work?
So, Holly, can I call on you to start?
Sure, absolutely. And more of this will be covered in the next section in terms of some of that logistics piece of hallways and special education.
We can wait for that then, Holly.
Okay.
Yeah. I wasn't sure what was coming next.
And if I forget about it, make sure to remind me.
Oh, yeah, sure.
Okay, are we ready to move on to the next section then, Kay?
Yes.
Okay, great. So with that, this section will start off with Polly. And we're heading into the various components, and we'll pause again prior to operations and then go from there.
All right, so I just want to thank everybody for hanging in there. We know it's a long night, but we wanted to provide as much detail as we could. We know it's important for our families and our staff as they start to look at decision making and the commitments to have the details of what the day may look like, including hallways, classrooms, what do we do for social emotional learning. We also know and recognize that our classrooms are going to look and flow differently. And so we want to paint that picture tonight as best as we can. So again, we have the details to be able to make decisions. So the next several slides, you're going to see some of those safeguards in order to provide that safest environment possible at this time. So when we think of social emotional learning, our school climate team is phenomenal and has always put at the heart social emotional learning. It's essential and a foundation for our students. We've talked about this before. Now more than ever, it's essential. We think of the different types of trauma, the level of stress our students, staff, families have been on over the past few months. This is an area that we continue to ramp up to support our staff and our students and families. So we're going to continue with our kindergarten through 8th grade to make sure they have access, whether that's virtually or in person, for SEL through our Second Step program. We know the soft landings at our buildings, again, virtually or in person, are a huge piece of the work we do with students. Connecting with them, building relationships right from the start of their day is critical. Those will continue. We know we need to integrate those resources into Canvas, and we need to provide materials and resources, especially at our high school level, for our staff. We don't want them to feel like they have to create everything. There are great resources, great curriculums and programs around social emotional learning so that we are all in the same boat, rowing in the same direction on this. We'll continue sources of strength. That's at our secondary, at our high school level. We know we will continue to provide opportunities and support for SEL to our students and our staff. Our staff are impacted as well. Castle has put out a great resource. If you haven't seen it, the Roadmap to Reopening has some phenomenal information in it. So again, our school climate team has been delving into that right from the start, making sure we're on the right track. We will adapt our United Way PATH programming to make sure we can continue to provide access to healing and our PATH services. We're going to continue our wellness screens in 3rd, 9th, and 11th grade with Samaritan Counseling. And then we know we're going to partner with our students and families even when we're not in a physical space. It's important that 5 days of engagement is equally important, whether it's virtually or in person, especially around that social emotional learning. So this is a big commitment area for us, and we know it given the last few months that our families and our staff and students have gone through to ramp up this area. So we're going to commit to that social emotional learning. When we think of attendance, also a critical area. This year, when we think about attendance, we think about being present, being engaged, and being supported. And again, that is virtually or in person. Those three things have to occur in order for students to feel safe and want to be in our buildings or virtually with our staff. So we're going to continue to have our attendance teams. We're going to look at how do we adapt our process to identify students at risk during a hybrid or a virtual learning. We know we need to increase our opportunities for engagement. I think we learned a lot last year when we had to, due to the health crisis, go into a virtual format. We learned a lot, and we have taken those experiences to create a better framework for virtual or hybrid learning. We will continue to coach our attendance teams. We're asking to think about our appointments that our students may need and schedule those outside of the school day. And then we think about our 4 key areas of connecting, and that's simply just making sure we have a pulse on our students. We have a right phone number, we have right emails, we've talked to them. So that's contacting. Connecting is making sure they have the right supports, whether that's technology, whether that's social emotional, whether that's academic. Relationships are critical. We need our families and our students, we need to be partners together to problem solve. And then participation's engagement. And again, we're working currently on a detailed process of what does engagement look like in a virtual and hybrid world? And how do we make sure we continue to follow our state statute requirement around attendance, while also knowing that this is a unique experience for our families and everybody comes with a story. And we need to recognize that, but we also know we need to make sure our students are engaged in learning. So we also want to recognize that we have students of all abilities, and these students need different opportunities. And so we want to make sure we provide inclusive learning for our students with special education or English learning needs. We know we have to adapt our models to meet the needs of our students, and that there has to be some individualized services within there. In doing so, we need to strengthen co-planning, we need to strengthen differentiation, and we have to look at how do we schedule small group or one-on-one sessions to make sure those targeted supports are in place. But we recognize that we have learners of all abilities and we have to meet their needs. So when we think about special education, so here's an example of what this would look like for a student with a disability. And I want to preface this saying that we need to always start with the least restrictive environment, and that's our general education. And so we need those instructional models to be able to move forward because that is our least restrictive environment. So once those are established, we can keep painting that picture for what that day in the life will look like for a student with a disability. But right off the bat, we know we have mandates. We're going to continue to hold our IEP meetings virtually unless unique circumstances exist. And that would be based on an individual basis. We know sometimes in person's better if we can do that safely. But right now, we would say that all our meetings will be held virtually if we could do so. We will be documenting and ensuring each student has the special ed instruction and are making progress towards goals. If they are not, an IEP meeting has to be reconvened to make sure we have the proper supports in place so students can be making progress towards those goals. We will continue evaluations under a timeline. We have also alternative programs, Project Search, Higher Ground, Pride, the Appleton Cooperative Education Center, housed at the Justice Center, that have to be looked at as well. And we are looking at those, and those teachers are engaged in the work. We know we have to partner with our families, especially those of students with significant health concerns. And we have to allow flexibility. There might be additional in-person learning days for certain students with disabilities based on their individualized needs. So they may be in a hybrid model where traditionally they may be in school 2 days a week. That may look differently for some of our students with disabilities, given what we know about how they've responded to virtual instruction in the past. And then just a really huge point to emphasize is that we're currently finishing similar information for EC4K, kindergarten through 4th grade, 5th and 6th grade, 7th and 8th grade, and 9th and 12th grade, in terms of very detailed what the day in the life of a student in those grade levels will look like prior to our weekly message being sent out on Friday to help guide this decision making. So a lot of specific details will be coming in that Friday family message, so that will help our families guide their thinking. Today we'll go over some general requirements. You'll get a good picture of it, but very detailed information will be coming on that Friday, July 31st to our families. Know also that extended day learning programs, or before and after school cares, are in development. Steve and I have been working with our Boys and Girls Club, our YMCA, just fabulous partners to say how can we meet the needs before and after school, as well as how do we meet those needs of the 5th and 6th grade and their families. I can't thank our community enough for reaching out and saying how can I help and what can I do to provide that support, that supervision, whatever it could look like for our students in a hybrid model. So that is in progress and more to come, but fully engaged, and they are ready to provide the services in a safe way possible. And the same thing with co-curriculars. We know this is critical to our students. This is that well-rounded child, and a lot of our students are engaged in school because of their co-curriculars. And so we're working what that would look like to keep our co-curriculars moving forward in that safe manner. Similar to our athletics and the phased-in approach, we are working to do that with co-curriculars as well. So that is an area in progress. So I know that was relatively short section, but if we're okay to go into operations, and then I believe we're going to take questions at the end of operations. So Claire, if you could go to the next slide. So, you know, as a parent, as a student, as a staff member, what does a classroom look like? And so here are general requirements that our classrooms are going to look like. As mentioned, we talked about requiring face coverings and masks. And I really want to emphasize that asterisk. It's going to be based on individual needs. We know that there are some students that are going to need individual discussions about what that face covering may or may not be. And so that will be done on an individual basis. They will be cleaned every day and provided to our students so that we create that equitable approach. We will make sure our classrooms are have restructured seating with students facing in one direction. And if there are tables that need to be utilized versus desks, that we would have that plexiglass or a barrier in between those students. And our goal is to have our desk space 6 feet apart. Again, really working on that physical distancing. One of the pieces we'll utilize and continue to utilize even through the secondary level is seating charts in every class. So students move directly to their seat. And the rationale for that is that we want to limit the amount of contact and transmission between students. So they know where to go and what to do right from the start. Our goal, if we can, is to eliminate sharing of classroom supplies or academic manipulatives. But if we need to and we need to share, we would disinfect before sharing. We'd organize our classrooms to promote individual supplies for students. One of our goals is we'd stagger our classrooms releases to reduce hallway crowding. If at all possible, we want to utilize large rooms or outdoor spaces to promote learning and promote that physical distancing. We have required our students to hand wash before entering and leaving the classroom. And note that this is district issued supplies and student safe. So Mark Hansel has done a great job of making sure the supplies are available and that they are student safe. So it's a wash that does not harm our students. We're going to expect our students to wipe down their desks after meals. Remember, we have breakfast in the classroom in some buildings, and we'll talk about lunch in a little bit. Prior to leaving for the day, again, district supplied and student safe. We're going to use a home-based model approach, meaning that in the elementary level, music and art are going to either come into their classroom or be done virtually. So the students will stay in their home base with their family in their classroom for music and art. We will provide recess and we will provide Phi Ed with our safety precautions. goal being that Phi Ed can be outdoors as much as possible. During certain portions of those, there would be no masking. Due to the safety of physical activity and masks, we would have those precautions and we would teach that to our students. But we know recess, Phi Ed, getting that exercise is important. We're going to create schedules to reduce the overall number of contacts throughout the day. So that will look different at every level. And I know our principals are working right now on ways to do that. We're going to ask students to remain on their desk until bell rings and then release by rows. Again, to prevent that crowding in the hallway, through the door, at the lockers, those kind of pieces. And then we're going to continue to monitor air quality in our classrooms and our building across the district. And would like to ask Mark Hansel if he could just share a little bit about how we make sure our air quality is safe for our students in our buildings.
Yeah, the way we handle air quality in our buildings and the way we'll continue to handle it is through proper operation of our mechanical systems. So we ensure that we bring in the appropriate amount of outside air, filter that air, and then heat it or cool it as appropriate, and then supply it to the classroom spaces and other spaces. So ensuring that all that equipment is running the way it should is very important to ensure the quality of the air stays appropriate. And that's no change. That's how it's always been and how it'll continue in the future.
Thank you, Mark. So we wanted to give a flavor of what that classroom would look like, knowing that, again, it's going to look different and the flow will feel different to our students. From coming back from March, it may not feel like the same classroom to our students and our staff. So student transportation, please note on the left-hand side that at this time, field trips will not be scheduled. We'll continue to monitor that and make sure we're able to go on our field trips when it's safe to do so. We also are encouraging our families to walk or bike to school if possible. And our goal in doing that is to reduce the amount of students on our buses so that we can physically distance. So you'll notice when a student, if you're taking transportation through Lamers or through a cab company, when they enter that bus or that cab, they're going to wash their hands. They're going to wear their face coverings when they're in the vehicle. And our adults, our paraprofessionals, our drivers are also going to be wearing those face coverings. And again, stressing that individual determinations will need to be made for the drivers as well as for the students. Now the drivers, just when they're parked, obviously waiting at the transportation drop-off would be, but not while driving. And our students certainly would have to be made on an individual basis. Assigned seating on buses to allow for efficient contact tracing. We're going to load the buses from the back to the front, considering those who have to get off at a transfer site. And again, that's to try to prevent the viral transmission between students. We'd like to keep the first row of seats vacant as a buffer zone. We have ordered and have available our PPE for our paraprofessionals who may come in contact with bodily fluids while on our buses or in our cabs. Our cab companies and buses are looking to potentially install plexiglass around their driver for extra protection. We'll make sure we disinfect our vehicles before and after each route. And we'll do that together with our paraprofessionals and our drivers, our bus drivers. If it's a nice day and weather permitting, we're asking that windows be open for better ventilation. And we expect our drivers and paraprofessionals, similar to what Julie King has mentioned, to self-monitor their symptoms for any signs of COVID-19 prior to their shifts. We ask that families think about not carpooling together with other families. And we're going to do our best we can to strongly encourage 6 feet of physical distancing while students wait either for the bus or at the transfer site for the next bus to come. So again, that's how our transportation will look as we head into the 2021 school year. So when we think about meals at school, we know it's important that every student has access to a healthy meal. So saying that, we are committing to continuing to provide meals to students who are learning virtually. We will work with Chartwell's Food Service to choose a delivery service model when students are in attendance. And so Chartwell's has a wonderful playbook. They call it a playbook. And when looking at their models, we really believe that when students are in school, there's two options that a site may choose based on the structure of their site, and that would be the food brought to the classroom, and that's typically for our elementary students, where that student would eat then in their classroom with their home base. Or at the elementary level, students would walk to the cafeteria, grab their food, and bring it back to the classroom. So at this time, we are not looking to utilize, unless we have to, and we may have to at our high school, middle schools, the cafeteria, but especially at our elementary schools, really looking to utilize possibly that classroom to keep that home base, that family structure. You'll notice our high school campuses we're asking to be closed to avoid large groups of students congregating in vehicles, at local businesses. And then when we do utilize a cafeteria option, which is at our middle schools and high schools, we're asking for physical distancing. We're asking them to be faced the same way, empty row between students to, again, make sure there's distance between them. When students are eating, they would not be masked, and we would teach students when would be appropriate to be masked during mealtime and when would not be appropriate time to be masked or have your face coverings on. But again, we're going to leave it to the site to determine what best meets their needs in terms of utilizing a classroom delivery model or utilizing students going to the cafeteria, bringing it back to their classrooms at the elementary, and then secondary using the cafeteria. So currently our school buildings have health rooms, and our health rooms have been used for multiple reasons. And so now that we have this virus of COVID-19, we are really asking our buildings to use the health room only for non-COVID issues or concerns. That would be medication, might be in needing an ice pack, a Band-Aid, but that health room is for non-COVID issues or concerns. When you're in the health room, we would require that face covering. We would have our teachers call the health room supervisor before sending a student to health room to avoid overcrowding. We want to make sure that it is a controlled environment as best as we can. The staff that are supervising that health room would be required to wear gloves and masks while administering medication. And they would be required, students and staff, to enter the room one at a time, hand sanitize, and take medications. We would increase cleaning of our health rooms throughout the day, and we would be removing the pillows and blankets on the cots that are currently in our health rooms. So a new component of our school day or school building would be what we're calling the health isolation room procedures. And really, we know we need to create a health isolation room in each school. And that's the room in which we would have students that have developed COVID-like symptoms. And so students would be sent to the health isolation room if they have a symptom of COVID-19. Staffing of a nice health isolation room, we would ask that we have a dedicated health isolation room supervisor, again, so that we don't cross-contaminate and that supervisor is truly designated for the day in that health isolation room. When they're there, they would have high-level PPE, and they would also have access to communication devices and phones so that they can communicate with staff, but also with their families. We have procedures developed to escort students to the health room. And then we also have procedures for supervisors to escort students from location to their parents. So that, again, we really try to mitigate the risk of transferring that virus, that infection to other people. So trying to contain as much as we can the symptoms and the potential virus of our students and our staff to that health isolation room. So our bathroom procedures, we would encourage hand washing before and after use of the bathroom, and this goes across the grade levels. We would expect students to wait outside the bathroom on taped areas for an open stall. So we don't want congregating in our bathrooms. We would have reminder signs with physical distancing and hand washing instructions. If available and if need to, we would block or close some urinals to allow for physical distancing. We would have our bathroom doors propped open if privacy can be maintained. And if we have the foot pulls available, we place those on the bathroom doors so that the doors cannot be propped open. We would encourage use of touchless paper towel dispensers. Now, certainly not every one of our buildings has that, but if they do, they would be encouraged to use the touchless paper towel dispensers. We would make sure a garbage can is near the door to dispose of paper towel when leaving the bathroom. And we'd make sure we turn off all the air dryers just to prevent that spread. So locker rooms, for the schools that do have locker rooms, we would consider closing showers as needed. That looks differently in our schools and at our levels in terms of how many students do shower, how many athletes do shower. So if they're not in use and haven't been used, we'd ask that those be closed down. If showers have been used or will be used, we'd encourage flip-flops or water shoes for showering. We'd make sure we increase accessibility and the amount of hand sanitizer stations. We would close down any unused locker rooms. And again, we're going to limit the number of individuals in that locker room to be able to maintain that physical distancing. And giving some visuals so that students do remember that physical distancing and where they need to be in the locker room as well as while they're waiting for the locker room to be open. For fitness centers, weight room procedures, we're going to require that equipment be cleaned by its users. Again, we're going to increase those hand sanitizer stations for individuals to use before and after using our equipment. We'll switch from paper towels, to paper towels for wiping down equipment. We're going to increase the cleaning schedule of these along with the equipment. We're going to post those signs as visual reminders. If we have to, we'll block or turn off some equipment to maintain physical distancing. The best we can, we're going to increase our outdoor air as much as possible, potentially by opening some windows or some doors. Following CDC guidelines, we will not wear a face covering or mask during physical activity, but if we have someone that is spotting somebody while lifting, that spotter would be asked to wear their face covering or mask. And then shutting off our water fountains and encouraging students to bring individual water bottles from home or having cups alongside of the water fountain, so it could be a single-use drink versus students drinking out of that water fountain. So we've also thought of our office spaces. And again, we really want to paint a clear picture as best we can for what our schools are going to look like. So for office spaces, if needed, we'll have a barrier potentially for that secretary greeting visitors, family members. They will be required some face coverings and masks. We're going to encourage the physical distancing, the hand washing, encouraging good hand and cough hygiene. Our goal is to reduce the number of people that interact throughout the day in our school office. We'll provide additional cleanings and disinfectants in those areas. Our goal is to provide a space to drop items off for staff or students. So a lot of times we have items that need to be received by a student or by a family, and so creating a different space so that families don't have to come into the building if they choose not to, and that spot is safe, has great airflow, and has the necessary precautions for a drop-off space. And we'll adjust those sign-in, sign-out procedures. So potentially could be single-use pens. Maybe it's pencils that get disinfected each time after every use. So just making sure we're really thinking about all the places that are high touch that we can either prevent or provide disinfecting and cleaning to prevent that spread. Given where we are asking that we restrict visitor access in our school buildings at this time. We would allow parents and guardians to drop off and pick up their student in the office. And we're ensuring that vendors or any contracted service providers that do have to be in our buildings for essential work, that they are following our guidelines. So we want to make sure that those in our buildings are essential and that we do recognize there is a need for parents to interact with their students. That would be done in the office as safe as possible. So I think it's important to recognize that this work has been being done by our school nurses since the beginning of April. They right away have looked at how do we, when we return, keep our students, our staff, our community safe, but also engaged to instruction. And that's always been a priority. And so our school nurses have worked really hard Since this pandemic has hit, they worked hard before that, but this really has really called them to their profession, and they've connected with our medical advisor. They've connected with Kurt as our city health official. DPI, they have their meetings with their nurse consultants. And as we started to plan for return all the way back in April, we thought, what's the framework? What are the places we need to really think about in order to keep our students safe? And you'll see that's kind of what started the work groups. And so throughout the month of June, we had about 20 work groups going, from administrators to staff to different, we had secretaries, we had paraprofessionals, we had community members, Kurt participated, we had our medical advisor. There was about 100 plus staff in these work groups that really tried to form the basis of each of those areas that you saw me present. Bathroom, office, all of those are what those work groups came together to do. Those work groups then took their recommendations to the school safe review team. That was an additional 70 representatives roughly, including again our administrators, parents, we had students, and we had our community partners. So it was seeking feedback from different lenses all throughout this process. And I think it's just a hats off to our school nurses and our staff as they continue to navigate these waters and create an environment that's as safe as possible for engaged instruction to occur. And so just, I think that's important to know the basis of how our planning began and where those areas came from as we work to provide a safe environment for learning. So I'm gonna take any questions from that section that you may have.
No questions? Oh, Chris, okay, go ahead. You're muted, Chris.
Thank you. I do have a few questions, Polly. I appreciate the specificity that you shared with all of these processes, and I hats off to all of the individuals in the district who spent a lot of time looking at all of those issues. My couple of questions, at the middle school level, are students still moving from classroom to classroom for their classes?
Yes, at this point, they are. We really, again, we had to weigh that feasibility piece to this and how we do business. And so right now, the intention is that they would limit as much as possible. The principals are looking at what schedules may work, where we would limit as much transition, but there will be transition at our secondary level, including the high school.
Okay, middle and high school. And then will there be any attempt to have any sanitizing going on in between those classes moving?
So our goal is that when a student leaves a classroom, even at the secondary level, they use the wipes that are student safe as they leave, toss that in the waste paper basket, and when they re-enter a classroom, they're going to wash again. So that they have when they leave, they're in the hallway and they come back, they're gonna wash again. And we work to create a efficient process so it didn't take away from learning. And Mark Hansel has found great resources for us to do that.
Okay, then in a typical elementary classroom, there's often soft furniture, beanbag chairs, pillows, rugs, that sort of thing. Will those still be options, or will those be removed as well?
And I'm gonna, Nan, jump in if you want to, but right now when we think about using the space we have and needing that space for social distancing, most of that will be removed so that we can maintain that physical distancing. There is still conversation around at our younger levels what carpet time may or may not look like, circle time, those kind of pieces, but I would say our students and our staff can expect a limited amount of furniture beyond their desks and the essential needs at this time. Again, to promote that physical distancing. Nan, anything to add?
No.
That was part of,
You did a great job.
Anything else, Chris?
that was part of my question to Polly as to how some of those processes might look different than in particularly in an elementary classroom where you do have the circle time and a lot of small group learning or paired learning, and just, I don't know if you can speak to that just a bit about how you see that.
Absolutely. Well, that to me, I look at that as best practice, right, in delivering instruction and how we deliver it. Small group talk and turns, those kind of pieces. And right now, our assistant soups are working with their levels and their leaders at that level to flush out to that level of detail. So families can anticipate on Friday receiving a very detailed day of what their student would look like in terms of, are we having circle time? Are we going to be able to be in small pods of students? Are we going to be having book talks together? Those kind of things. So right now where that is at the level. So it's at elementary levels working through their process on detailing that out, middle school as well as high school. So that will be, our goal is to have that in our families' hands on this Friday.
Thank you. And then I just want one more question, if I could. And thinking about the changes in all of those processes and thinking that there might be 20 students in a classroom, at least in the beginning, in the early grades, is there the thought that there would be additional adult support in classrooms to assist with all of these?
That's a great question. We have to look at how we have the training. We know what we need to get to our staff. It's how do we do so and when do we do so that we don't bring more people unnecessarily into a classroom to look at that contamination and kind of creating more people in the classroom to spread that virus. So one of the pieces we're looking at is how do we utilize the before school days to be able to train and make sure staff have the proper equipment, have the right process, feel supported in that. But ultimately, there may be times where additional staff do have to come into a classroom. But our goal is to limit the amount of people coming in and out of classrooms as best as we can.
And that's a good goal. I just think about 20 young students in the beginning of the year as you're trying to develop these behavior patterns, and how that might be very challenging for one teacher and 20 young students.
Nan, did you want to chime in?
Yeah, I can certainly say, Chris, I mean, it's always all hands on deck when our kindergartners join us. And so we've always made a prioritization for different circumstances. And in all these cases, every building's footprint is different. Every building's classrooms may have tables or desks or different configurations. So I'll be working with the elementary principals to look at their specific situations. Mark Cancel and I have already talked about those plexiglass dividers that can be put on small group tables so that small group instructions can continue safely. But we will work through that. But then again, each building will have a little bit of a different flavor depending on their building structure.
Okay, and then my last question, I promise, is regarding traveling teachers, and maybe that's going to be addressed as we continue on. But just kind of the logistics of that when we're trying to limit the number of contacts that people have.
Yeah, that's a great question. We did have a work group that worked on that. And really they come up with some processes because there are certain staff we at this time can't limit due to law and required services. So physical therapists, occupational therapists, they will be traveling to multiple sites. They will be looking at a higher level of a PPE as they go into buildings, and then having to switch that out before they enter a new building. They'll also be taking logs so that if something should happen in a building, we know what students they interacted with to the best of our ability for that contact tracing. So we're really looking at how do we increase the PPEs for them, the protection, as well as the disinfecting as they leave a building and before entering again. But we did have a work group. There's still conversations to fine tune some of that. But we will, as you point out, Chris, we do have quite a bit of traveling staff in and out of our buildings. And so some of that comes to a scheduling and some of that will just happen given the nature of our staff.
And then specialists too, like art, music, and FIED, who might be moving room to room, would they be keeping a log like that and have additional PPE as well?
Right. We would certainly work with those traveling staff, whether it's within building traveling or outside of building, to say, where have you been? What do you feel safe with? Those kind of things. And I know our fine arts department had a lot of staff on our work group, and they have things all the way down to instruments and sanitizing and those kind of pieces all laid out already.
Thank you so much.
So Kay, you had your hand raised?
I'm wondering if Mark can address the question that came up in a number of letters that were shared, would be the lack of air conditioning in some of our buildings, and now not using fans. Often school starts and that's when we get a major heat wave.
Yeah, I think we discussed that a couple of different times with the leadership team, and you know, a lot of our classrooms do have operable windows that we'd like to utilize to bring in fresh air. There's not a whole lot we can do about air conditioning in the classroom, given that our buildings are, you know, all from the 40s and 50s and such. So as far as cooling goes, you know, it'll be very similar to years in the past where, you know, we'll like to open windows and try to bring in as much fresh air as possible.
Let's see, Gary?
I just had a couple quick questions. N95 masks, are those exclusively for people in the healthcare industry? I'm just wondering if there's any chance teachers could get those. Or other educators.
Yeah, right now we do have a vendor that has access to them. They do have to be fitted, and so there's other steps associated with that N95 at the medical level. And Kurt, I don't know if you have any pieces there, but we do have access. There's other pieces to consider, such as fitting and sterilizing, that go with the N95s.
Okay. My other question was one of spaces, getting a little creative, maybe having classes outside as much as possible, and then maybe you made a comment on that, or I think one of the letters actually we received talked about erecting a tent, maybe if the weather, you know, was going to cooperate for a few days. You know, it sounded like not a bad idea if you didn't need the technology that was in the classroom or something, right?
Mm-hmm. Yeah, absolutely. The more we can space out and use either larger areas in our buildings or the outdoors, we feel that's in our students' and staff best interests.
Thanks.
Barry?
Okay, so is there a place for impaired parapro, you know, in the scheme, or are they always going to be forced to be with kids?
Julie? I think the question is for Julie.
Yeah, we have to look at positions individually, and what's going to shape that is really what comes out of the models with enrollment. So where we had some success last year was in the virtual model, we had some paraprofessionals that did follow-up with students and worked individually with students virtually. And that may be an option that we can explore for some of our support staff.
And then again, I want to just thank Kurt for being so involved in this. You know, over the years, you've been quite a force in the community, and I'm glad they extended your contract, or rather you extended your contract for one more year to stay with us through this. I'm not sure what you were thinking. The other questions I have is, again, thank you, Judy, for your leadership in this. This is a very thorough presentation. I do have a question. I just want to be there when the first change of class occurs in one of our 3 high schools, because I don't see how that staggering doesn't, you know, they leave a classroom, they got to go to another classroom that's filled with kids, they got to go to another, you know what I mean? It's just not, there's no organized way of doing it, and they love to kind of camp out and chat with friends, and so that's going to be a interesting phenomenon. And of course, the other thing, as I reflect on this, we have neighboring districts that are doing the full 5-day, no changes. Some, you know, I'm just kind of curious how their experience will be different than ours with our hybrid model. It'd be a nice comparison. Hopefully both are successful as we go forward, but it's kind of a way to evaluate some of the stuff that we're trying in comparison to other districts. We have different demographics than most of them, but still it's, you know, the process of trying to prevent spread is similar. And then the only last thing I'd say is this: a lot of this depends on how good our virtual option is. And you know, there's a lot of concern about what happened last year, and I hope our staff realize that for that to be viable and appreciated, it needs to really be quality, top quality, and I'm sure we're on the path to that. And I know that that's on the minds of a lot of our parents who are writing letters to us. And then finally, one first grade teacher that I know wanted me to ask a question about how do you figure out bathroom for little kids on the first day. And I think you've already covered it, but apparently that's a big issue for first grade teachers with little kids wandering in the bathrooms on and off during the day. And how you manage that, because they don't particularly, I don't know, is that a big problem?
Well, you know, Nan, feel free to jump in. I think it's just, again, going back to teaching, but yeah, those little learners are something that we need to continue to model and share expectations, and it goes all the way down to, we've had discussions on what do bathroom passes look like, so that it doesn't transmit disease. It's the amount of details our staff have thought about is quite phenomenal. But Dan, any comments on those little learners?
I would say every classroom from EC through 12 spends a chunk of the beginning of the year talking about routines. I think in particular our early childhood 4K kindergarten and first grade teachers maybe spend a little bit longer with that, but we're working on potential video supports for that, and also our school climate with our PBIS with those expectations. So we'll teach, and monitor.
There other comments, questions before we conclude? Okay. Clara, if you wouldn't mind bringing up the concluding slides, please. So Polly shared some of this information in her slide about the process that we've followed, but just a reminder that as we continue our planning, it is really based on that initial planning that began with our school nurses back in early April. And I would like to echo Polly's gratitude to our nursing department. They were able to sort through all of the competing pieces of information that we were receiving throughout the months and really help us drill down in collaboration with Kurt and others that have been mentioned, but our school nurses really did take the lead. And so I'm forever grateful that they were able to decipher and really drill down and map out those work groups for us. And again, a huge thank you to the 100+ various staff members and community partners who made up those work groups and worked throughout the month of June, and a couple of them are still in operation, but really that gave us a foundation for what you heard today in our presentation. So information from our work groups. We also did a couple of surveys for our staff and families, one back in June and another follow-up one in July. In the middle of July, we had that review team, again made up of over 70 individuals who came together to give us feedback on that plan. And again, a huge thank you to that group. They came 3 consecutive days on short notice and really gave us some good communication, feedback, and other input for our team. So with all of this information, you see, you know, the expertise of our nurses, our local health officials, input from our families, and, you know, we do read all of those communications that come to us, and I think hopefully our families and our staff have heard that we have incorporated the feedback and the input to think about different ways that we can adjust our planning to meet the needs of our students. And I think that's really important for us to remember, is that our students are first and foremost our focus for all of this. So our job as a leadership team and as a Board of Education is to not focus on any one particular part of the information that's coming to us, but taking all of this together with the safety of our students at the forefront, and then followed very closely with the safety of our staff, because we know that we are responsible for almost 2,000 individuals and their families and 16,000 plus students and their families. So we take all of this information, and then looking forward to our families on July 29th through August 6th, that we hope that they can take the specific information they'll receive on Friday for what these models will look like for their student, and make that commitment for us so that we can take that best information and plan for staffing the opportunities that we so desperately want to provide for our kids and for our families. And then looking to that August 12th date again, where we will take another look, make sure that things are good to go, good to move forward, that we have the staff to cover the opportunities we want to provide, that we are in a good position to implement all of the safety protocol and procedures that we expect will keep our students safe when they are with us, and our staff safe when they are with us as well. And so providing this information for our families in our community will begin tomorrow. Kylie and I will review all of this information, make sure we have the most up-to-date pieces for our presentation to put out on our website. The Friday family message, as I said, will include those day in the life of pieces for our families as well. And then we also will provide an opportunity right in this presentation for our families to provide us with questions. What do you still need to know before we head into the school year? So it's a way for us to collect important information from our families, because we know that you still have lots of questions about the year. So we'll start with that. But then we also, as I mentioned earlier, will be following up for families who haven't made a commitment in the questionnaire with phone calls from the school sites, because we know our families trust our school leaders, and they have a very strong tie to their neighborhood schools. And so we are going to be empowering our school staff to be able to answer questions as well, so that when we head into the start of the school year, everybody's feeling comfortable with the information that they have received. And so this is just a reminder that, we as a team of leaders serving our community and leading our building administrators and our departments are very committed to continually reviewing what we're doing for safety, to make sure we are using best practices that we know make a difference in the spread of the virus, in the mitigation of the spread of the virus, that we are reviewing, do all of our kids have equal access? Are we being flexible? Are we empowering our staff to be able to switch as needed between the different models? And then again, that equity piece that is the foundation of everything that we do for our students. So with that, we will end this part of the presentation with just a review on the next slide, Clara. If we could just share that we do have resources that we have consulted that are linked in to this for our families in our community. And then we're working on a glossary. We have a start of a glossary, which is the next page. Some of the terminology that we have referred to throughout this presentation, PPE, what does that mean? Some things that I don't know that most of us even thought of, aside from Kurt and the nurses, but things that we feel were important for our families to know. And this will be an ever growing document, so that we will continue to provide additional resources and communication for families. So with that, we'll open it up for any closing comments, but certainly thank Kurt and others on the team who have put so much work into pulling this together for our families and our community. I feel we have a good plan. Moving forward, we certainly are doing our very, very best to provide the safest possible environment for our students and for our staff. So thank you.
Judy, I've got a comment, and that is, I think it would be helpful I'm really proud of the planning that you and your people have done, first of all. Secondly, we're doing something new. And therefore we can't know exactly what tomorrow will be like or what September 1 or September 15 will be like. So we have to do the best planning we can given what we know, and then go step by step and trust ourselves to take a little risk each day. And I think we're doing that. I think it would be helpful if the community understood that at some level, so they don't expect everything to be laid out perfectly. They don't expect to be able to ask picky, specific questions about what will happen on September 2 or 3 or 4 or 5 to my kid. They have to understand that this is new. We're all going together in a direction, and we're doing a little bit of exploring as we go. And I know that's unnerving to some people in the community, but if they can accept that, I think they might give us just a little bit more faith.
Well, as we start out a vision statement, working together, that's huge. And so working together does mean communication. So again, empowering people to step forward when they do have questions, but also being willing to say, at this point, I don't have the exact answer for you on that, but we'll work, to find the answer as much as we can. But it is really about working together. So empowering our families and our students. I think our students are huge in this, and their voice and listening, how are things going? So making sure to check in with them and empowering them to help us. And I think they'll step forward. I know they will. The student reps that we had on our review team were phenomenal. Their voice was very important. So it's a collaborative piece that builds the trust the more you work together.
It's like Leah has her hand up.
Yeah, I just wanted to thank everyone for the thoroughness of this plan. It makes me feel much more confident both as a parent and as a board member. And so, as you said, fits with our vision statement of working together, because it would be impossible to have captured this level of detail without all of these people working together. So it was very well done, and it makes me feel like we may be exploring new territory, as Jim said, but I'm fine with that as a parent if it's done safely. And I feel much more confident. Well, I always felt confident in the leadership of this district, but now having seen this even more so, I appreciate that. And I also am thinking back to our district scorecard, which was new in the last year, and I think it's the third pillar on family engagement and community partnerships. And I have said since joining this board, and it was part of the reason I wanted to join this board, that I thought there was room for growth in that area of really giving our families voice. And I think you have, as a team, have done that really well and are continuing to create space for that. And I think that is just particularly now crucial. But we've gone down this road, and we can, use those relationships for later too, because this COVID is not going to last forever. So thank you.
Gary?
Yes, I just had a couple quick comments. Kurt, first of all, thank you for your partnership and your guidance and professionalism over the years, and especially through this time. I think it's really important that the community knows that we don't make these decisions or analyze it in a vacuum, that people like you are at our disposal. And I know Judy mentioned even other medical professionals or partners joining us through this journey through the rest of the year and into next year and beyond. And I think it's really important that people know that and understand that. And also to the leadership team, everybody that's on this Zoom, and the work you did, I agree with everything that everyone else has said. What a fantastic, thorough job that's been presented to us and enabling us to make some very important decisions. Thank you.
Chris?
You're muted, Chris.
I would echo those thanks, and I think we've been given a variety of good possibilities and options, but I'm and we know that there's some specifics already and there will be more to come, but I am really struggling with the prospect of sending hundreds of students and adults into buildings, into school buildings, especially as I note that many businesses outside of education in our community have already made the decision that it is not safe for their adult employees to return to their work environment for the foreseeable future, many of them looking at moving into the 2021 before they're going to bring their groups back. So I'm also struggling with the fact that we're meeting virtually and making this decision about sending students and staff back into a school environment in the middle of a serious health pandemic. And when I think about the burden, that the number that was shared with us earlier, there's not a descriptor higher than high, and we're at 173. What does it mean? Do we get to 200? Is that too high? I'm just really struggling with creating more of the community spread. Thank you.
If I might respond briefly, I think we all share that feeling. And I think there's a part we didn't talk about tonight, and that's the decision not to allow children to socialize and come together for their mental health. And I know both decisions have outcomes to them, but I want to bring that voice to the table too, because families are struggling, and there's some positives that come together as well. And it is a risk, but it's a risk that families have choices by the plan you're laying out.
Are there any other?
Leah?
Yeah, I'm sorry.
Yeah, I just wanted to make the comment, having been back at work now since the end of May, I think it was, and also going out into the community, and I went to Pick and Save and everyone was wearing masks. And it was such relief. So I am looking forward to finally welcoming you in person, Chris. I can't wait for those meetings to happen. And I, for one, am very, very ready to come back as long as we are all wearing masks. So hopefully we can see each other soon.
I'm glad Chris brought it up and that Leah seconded it. I think if we're going to ask the teachers to work in person with their kids, we should be working in person with each other. I think we need to set the example.
Deb?
I know this is a tangent, but why don't we start with our August committee meetings? I mean, this is a tangent, but start our August committee meetings face-to-face, wearing masks. So that's my tangent.
Is there anything?
I have one more comment. I'm in agreement with Chris. I mean, this is a very serious thing. You know, we've got a nice thing laid out, but as Kurt has said, you know, responding to the experience that we have with this going forward is very important. And you know, if community spread and if we have spread within our schools, that begs the question. And the question needs to be asked if we're going to go forward with this and not delayed and have unsafe situations persist for a period of time because we're resistant to taking a good look at spread in the community and incidences within our schools. Hopefully there are none. And so, you know, as we set guidelines and where we're going to decide to pull the plug on this and when we're going to decide to expand it to all week long are very important questions. So this isn't easy.
I would agree with those comments. And I'm also, though, do want to say, given the amount of work in the planning that has gone into this plan and the contributions from Kurt and other from the medical community, I need to put trust that administration will continue to monitor in conjunction with Kurt, and we won't wait and have things spiral out of control. So I think this was a very detailed, very well thought plan. Many things have been considered. So I would echo the thanks for everyone that's worked on it, and also want to state I personally trust administration, and I'll keep close tabs on everything that's happening. So are there anything else, any other comments or questions? Or Judy, do you have any?
Just, yes, to say that we are in constant contact with Kurt. I don't know how many times a week we connect either with him or our, a regional COVID-19 group, which is area superintendents and county health officials. And so we are taking this very seriously and watching very closely, and becoming, I think, more aware of what has worked potentially, and how we can apply that more universally across the area. So we've worked really hard to keep that connection going. So we are not looking at just our city of Appleton, but we're looking at Outagamie County, Calumet County, Winnebago, and we're actually creating more consistency across our region because of these regular meetings where we hear from the medical experts. I am not a medical expert, but I am certainly know to listen to them. And so if I hear from our regional experts that these things are escalating more quickly than we could have ever predicted, we will put a stop and do what we need to do to keep people safe. So it's not a decision I can make alone. It's a collaborative decision with our medical health professionals, but there isn't a day that doesn't go by that we don't connect and monitor this. And I take very deeply and very seriously the health of the people who look to me. So. We will be on top of it.
And I'll just share, in case there are parents that are watching this broadcast, we are expanding our contact investigation capacity. We're going to be hiring probably 8 additional nurses that will be helping us. So if and when cases do develop within the school district or the community, we have already built and will be training a surge capacity for that. So just to support what Judy just said, we will be able to respond should we see cases within the school district.
Thank you for that, Kurt. Are there any other, Chris?
You're muted, Chris.
I do have faith in you and the team. I guess what I'm coming back to is that in order for a change to happen, it will likely mean that there will be individuals who will become ill and possibly seriously ill. And so that's my concern, because we are putting people in a situation where they're going to be going into an environment with other people. They do not know where they've been before. And there are many people who have since March placed themselves into very safe environments, masking, keeping themselves in small groups. And so I just am sharing that. It's not that I don't trust what you or the team will decide. It's just that it seems as if that we will have individuals, students, staff, community members who will become ill before we make that decision. So thank you.
Leah? Oh, I'm sorry.
Well, no, I mean, I guess I would only say I really appreciated the fact that listening to our community, you are providing more of the fully virtual model. I mean, as I sit here, Chris, I'm stuck in this position of I have to go to work. I don't have the option of staying home. At the same time, I live in a multi-generation family, and I have two people who are high risk. So I get how hard of a situation and a choice this is for many families to make. And I go on a walk around our neighborhood every night with my husband, and it's been, well, what should we do? What should we do? And I keep saying, wait to the 27th, and we'll make a decision. And I am very grateful that we have the decision to be fully virtual right now, if that is the choice that we want to make, because we are taking quite a few more precautions than other people's feelings of risk are not all the same. Not everybody has been acting the same, and I get that. So I think that virtual model really helps me to know that it's there, helps me to know that I can move to it. If we start the school year and I'm like, you know what, no, we really, the district's doing a great job, but there was something that happened, or I heard maybe something that happened okay, pick another school district in the surrounding area. A child got sick, and I'm going to move to virtual. And I'm really pleased with the amount of detail that is going into keeping our staff safe, and I will look forward to hearing more about that at the personnel meeting, that we are recognizing we have staff who are high risk or have family members who are high risk and are trying to accommodate that as well. So that I commend you for those efforts, all of you.
Julie, did you want to add?
I don't think so. There'll just be more details that will be coming on August 5th specific to staff. It's more dedicated time there, I think, would be needed.
Gary, did you?
Yeah, and along that lines, that was my final comment, that when I came into this meeting, one of my chief concerns, in addition to the safety of the children, obviously, was the staff. And the paperwork and the data that you're going to collect here over the next few weeks is really, really, really important. And I think, like Judy said, I'm comfortable knowing that the leadership knowingly and willingly will change on a dime if need be. In other words, if those results come back and 37% of the staff is high at risk, or for whatever reason, I mean, that's not going to happen, right? But you would react accordingly. And if during the course of the school year, number one, the good news is children, families do have a choice. They can go virtual if they are totally uncomfortable with what's been proposed. So then it does lead to the staff question. And I think this discussion with them and the feedback from them over the next couple of weeks is really, really, really important to them, because I've received letters and comments directly about that. And as an employer myself, back in April, we had individuals did not want to be at work, didn't feel comfortable, and we were able to accommodate that. And I think the Appleton Area School District will look at it the same way. It's a compassionate organization, not only for the community, but for their staff also. So I'm anxious and interested to see how we move forward.
It's like Deb has her hand up.
Right. I just, I think in reviewing all the information, listening today, having a few conversations with Judy and other people, I'm very, very impressed with the plan. I'm impressed with the fact that there's been all this communication with Kurt. I like the fact that families have a choice to go totally virtual. And I just want to thank all of you that put your time into it to put this together. Back to Kurt's point, the families, there are kids that need to get back in school. And it looks to me like they're doing safely. The team is ready to pivot if things head south. I'm just glad that we have this plan to consider.
I don't see any other hands raised. Judy, do you want to, we have an item of consideration. Believe that that's next on the agenda.
I guess I don't have it up in front of me, so maybe Kay, you could read it.
Oh, yes.
Sorry.
No, no problem. So the item of consideration is as we prepare for the start of the 2021 school year in the wake of the statewide closure of schools in March, in the ongoing COVID-19 pandemic presence in our community, the Appleton Area School District must have a comprehensive framework for optimizing equity and learning for our students in an environment that prioritizes the health and safety of students, staff, and the community. It is important the district has specific procedures in place that allow us to meet essential safety guidelines while providing the flexibility to transition between different models within the framework as necessary to respond to current and future health conditions as related to the pandemic. As a change in conditions may require an immediate or timely action on the part of the district, it is equally important that the administration be granted the authority to make decisions as necessary regarding transitioning between models in the board-approved framework for the duration of the emergency situation. The proposed framework incorporates recommendations and guidelines issued by the Center for Disease Control and Prevention, our state-level Department of Health Services, the Department of Public Instruction, as well as our local city and county health departments. The fiscal note is an estimate of $3,200,000 for technology, food service, facilities preparation, and facilities cleaning. Additional staffing costs are not known at this time. Administrative recommendation is to approve the proposed 2020-2021 AASD framework for a safe and resilient return as submitted, granting authorization for the administration to transition between different models within the framework as necessary to respond to current and future health conditions as related to the ongoing COVID-19 pandemic. Structural impact, safe, flexible, and equitable access to learning in any environment as we respond to the ever-changing pandemic conditions while providing important and necessary protections for the health and safety of our students, staff, and community. So, is there one who would like to make a motion?
I move approval of that item.
I'll second it.
Oh. Jim Bowman with a second. Any?
Either one of us.
I'm sorry.
Either Deb or I, either way.
Yeah, we'll co-second it.
That's super support. Okay, any questions or further discussion of this item?
Is there any plan to have board updated on how it's going?
Absolutely.
Okay, at what intervals?
Every board meeting or more frequently as needed.
Okay.
Gary?
My question, a couple of them actually. So that amount of money, the $3,200,000, is that for the school year, 2020, 2021? Or is that, for a period of time?
Greg, do you want to?
I can speak to that. That is the largest piece of that, Gary. The $2.2 million is for the Chromebooks for 4K through 6th grade students. Out of that $2.2 million, about $1.4 million will come from federal CARES dollars. The remainder will come from carryover from this past spring. If you recall, we did save approximately $2 million in a variety of areas where when we were closed this past spring. So those are dollars to get us ready to open for the school year. And so it's $420,000 for iReady software. It's about $225,000 for F&O equipment. That's everything Mark needs to have for our facilities to be up and functioning. And then $200,000 for our food service to be functioning. So that's just to get us ready from a facilities side, from a technology side. And we'll have to wait and see what the staffing costs may come in as. And that's going to be dictated by how many students go virtual, how many staff members are virtual. And so we should have a better idea on our staffing costs, hopefully by, I think the date we have on there is August 12th is what we're looking for. So no, this 3.2 million is to get us ready for the school year.
Okay, yeah, and that hit just about all the questions. Do we have to allow any cost for testing for COVID-19 in our realm? Or is that somehow connected, at a different level of government?
That is not anything that we have budgeted for. And so, Polly or Kurt, you may be able to answer that. That's nothing that's come across my desk as far as us budgeting for at this time.
And currently the co-pays are waived for any of our employees who are on insurance. So if they're going through any of the providers in the area, they're not paying the traditional co-pays for insurance.
Great, thank you.
Anything else? I do not see any hands raised. So I will, if there's nothing else, I will ask Clara for a roll call.
Gary Yankee?
Aye.
Leah Olson?
Aye.
Deb Truman?
Aye.
Chris Sauter?
You're muted, Chris.
Nay.
Barry O'Connor?
Aye.
Jim Bowman?
Aye.
Kay Eggert?
Aye. Okay, that takes us to the end of our, that was our only action item. We have some future meetings coming up. And with that, I will entertain a motion to adjourn.
I
So
so
move.
Jim, cut that out. Okay, I'll second.
I'm assuming there's no questions about that. Roll call, please, Clara.
Leah Olson?
Aye.
Deb Truman?
Aye.
Chris Sauter?
Aye.
Barry O'Connor?
Aye.
Jim Bowman?
Aye.
Kay Eggert?
Aye.
Gary Yankee?
Aye.
All right. Well, thank you all very much. And actually, and again, thank you to any community who still may be with us and stuck with us through this meeting. You are an important part of this process for us. So thank you all and have a good night.
Good night, everybody.
Thanks.